Hello, my name is Dr. Ari Moskowitz. I am a board-certified periodontist who has been in private practice in the Baltimore area since 2001. 4 years ago, I conducted a pilot study to see if IoTech's iodine technology would improve the periodontal health and stability of my patients beyond what chlorhexidine gluconate and/or hydrogen peroxide could accomplish. In that pilot study, I found that the reduction in bleeding and the reduction in bacterial plaque levels by utilizing IoTech's products was quite significant. I could immediately tell when patients had run out of the IoTech products and had substituted some other mouth rinse or product. Prior to implementing the IoTech products in my practice, we had patients putting a capful of hydrogen peroxide in the water of their water pick, or sometimes a drop of bleach. We also had them rinse with 0.12% chlorhexidine gluconate daily to attempt to slow the worsening of the periodontal disease. All of this with limited success. Since the time of the pilot study, I have had over 300 patients every year for the past 3 years who are regularly utilizing IoTech's iodine products on a continuous daily home use with much better results in periodontal health and stability than I had ever seen with 0.12% chlorhexidine and/or hydrogen peroxide. In my practice, we now routinely use IoRinse as a pre-procedural rinse since it's so much more effective than chlorhexidine. IoRinse not only reduces the bacterial load faster than chlorhexidine, it also reduces fungal load, and it completely destroys rhinovirus in 30 seconds, which chlorhexidine gluconate doesn't kill at all. So it is a much more effective agent in reducing microbial aerosols and the chance of respiratory infections. We use it routinely in our ultrasonic reservoir bottles for more effective deep cleanings and periodontal cleanings. I cannot stress enough that its use by patients at home each and every day is critically important in improving oral health and stability. We have patients using it nightly in the reservoir of their water pick, along with the pickpocket tip, before they floss and brush. I have patients using it as a mouth rinse to eliminate halitosis. I have patients using it as a rinse and topically applied after surgery to aid in wound healing and pain reduction. It dries up herpetic lesions quickly and appears to be more effective than nystatin for eliminating oral fungal infections and angular cheilitis. We also use it to help to control peri-implantitis. I have also worked with IoTech on developing a gel with their patented iodine technology for patients to place into periodontal gel trays. The iodine gel is more effective than hydrogen peroxide gel or irrigation alone. As you may know, periodontal disease can worsen many systemic diseases and increase the risk of heart attack or stroke, worsen diabetic control, and there is now evidence to suggest that it may worsen Alzheimer's disease. Because periodontal disease can have such a negative impact on our overall health and well-being, and because it is a chronic disease that worsens over time, like high blood pressure or diabetes, it is critical for patients to have more frequent cleanings and to have the most effective oral care at home as possible to help to control this progressive disease. I believe that the patented iodine technology that IoTech International has developed will become the gold standard chemotherapeutic agent in the fight against periodontal disease. It is the best weapon against periodontal disease since the use of ultrasonic instruments, and it is well worth your time to learn more about it, to put it to use for your patients in your practice, and to ensure its daily use by patients at home. You and your patients will benefit from better and more stable treatment outcomes from this very conservative, natural, non-invasive, and painless care.